All right, swimming injuries. So a lot of there's contact injuries that can happen with swimming, or maybe more with diving if people slip off the diving board. And I've had people hit their heads and tear the ligaments in their ankles and all kinds of stuff. But for the most part, most swimming injuries are at the shoulders. And a lot of these injuries happen in the shoulders. Let's just say the shoulder is a very unique joint. It's so mobile compared to like the elbow, which bends and straightens. The knee bends and straightens. The shoulder can move so many more degrees of freedom, or it has a lot of motion, a lot of mobility. It's a great thing, but it's also, I guess, inherently one of the flaws, or one of the problems that can occur is that you can actually get too much mobility out of the shoulder. And the primary problem that I see in swimmers is that they have too much laxity at the shoulder for all the strokes that they have to do. This stroke, which was a terrible stroke, by the way. But they have to have so much mobility to perform their strokes, they often get laxity in the shoulder joint. So if your shoulder joint is this is the socket, this is the ball. What happens is oftentimes the ball gets too loose. So the rotator cuff, the muscles that are responsible for keeping that ball in place and producing pure rotation in the joint, those are maybe not as strong as what they need to be, or they're not as they don't contract when they're supposed to. And you get a lot of sliding and gliding in here instead of pure rotation. So this can be termed impingement at the shoulder. And that's one way that you can have. So you can have laxity of the rotator cuff. Another possibility is that you could have some laxity or instability or weakness of the muscles that control the scapula. So the scapula makes up the portion of the socket. So if you don't have good stability of the socket, then you're going to cause all those problems as well. Imagine if you don't have good stability of your socket and you don't have good stability of the rotator cuff as well. You get all kinds of sloppy movement in here. So instead of pure rotation happening, you get all this other crap that's happening, and it can pinch on stuff. It can tear stuff if it's extreme. And so the best way to help a swimmer out is to get them really strong muscles that control their scapula, primarily their serratus anterior and their lower trapezius muscles, and also really good strength of the posterior shoulder, the posterior rotator cuff. So there's muscles on the back side of your shoulder. We want to try to have a posterior dominant shoulder, meaning that we want the back of your shoulder to be at least 50% of the strength of the front side of your shoulder. And we say that because the front side muscles are so strong. Old school mentality was kind of thought, well, if you have this micro instability at the shoulder and the ball keeps popping out the front of the shoulder, we just need to beef up the chest muscle so the chest muscle holds it in. In actuality, the chest muscle attaches right on the front of the ball, almost right on the neck here, and if it's too strong, it actually pulls out. So you can actually make it worse if you try to strengthen up the chest. So we need a more posterior, the back of our shoulder needs to be as strong as we can get it, more so than the front side. So again, swimmers don't usually have a problem with mobility. They have a problem with strength and stability of their rotator cuff and their scapula muscles. Those need to be addressed.